Okay.
Welcome to Health Matters by Wyoming County Healthcare Center. In each episode, we interview different healthcare providers. In this episode, I welcome Aaron and
Amy. And Amanda. Yeah, we'll go by whatever you
you want
us to
us
be.
We can be Aaron.
From DaVita Dialysis.
Yeah.
To get us started, I would like to ask you a couple of questions. Can you tell us what DaVita does here at the Wyoming County Healthcare Center and who it serves?
Sure. So I'll start.
Rock, paper, scissors?
Yeah. So DaVita actually stands for He, She Gives Life. So what we care for is people in the community that have kidney disease and that need dialysis to help clean their blood. So that's the population that we're dealing with, is those that are in end-stage renal disease. A lot of them have diabetes, hypertension. Besides the kidney disease, they have a lot of other things going on, but our main focus is on their kidney disease.
Mm-hmm.
And I'll add that the Wyoming County Healthcare Center, we have DaVita here, and we do dialysis for a lot of patients in the community and outside of the community. And it's just great. And even the patients say just having something so local to be able to do a life-sustaining treatment is great. So we're very happy to be here.
Cool. What does a typical day look like for your team and your patients?
Oh boy.
Well,
early. We start early.
I start the night before. This is what I always, when I'm interviewing people that want to work in dialysis, I always say, you start the night before. So I pack my lunch and I put my clothes out and get ready, because our first technician comes in at 5:15. So she kind of turns the lights on, gets the place going. We have a whole water system that we have upstairs, so she gets that ready, starts getting the machines ready for the patients. So usually that takes, to get the whole clinic set up, about 45 minutes.
Yeah.
Mm-hmm.
And then at about 6 a.m. is when we open the gates. And the patients start coming.
Running.
We hit the floor running. That's when we put on our smiling faces and get out there. So we have 12 stations upstairs, so we can do 12 treatments at once. And then we bring the patients in 3 or 4 at a time. Assess them, take their vital signs, blood pressure, and then their treatments are by a prescription from the doctor. So once they get on the machine, it's usually they're on for 4 hours.
Yeah, and it's very individualized. So we have to monitor each patient as an individual, because they don't all react to treatment the same. And it's funny because the clinic, we are known as the raccoons in our clinic. It's true, because we create good mischief in the clinic. Amy and I are extremely silly. We like to make the environment a little lighter for our patients and our staff, because it can be extremely overwhelming. And we just like to provide a safe, fun environment for them. And so if we could, that's just how we are. We're just silly.
They're here 3 days a week. So 3 days a week for 4 hours at a time. We spend sometimes more time with them than our own family. So they become our family. They know everything about us. Yeah, we know about them.
Yep.
And so we do usually 12 patients in the morning. And then we have a busy time where they're coming off. And then 12 more patients will go on for a second shift, and same rodeo, same thing, and we wrap it up about 4:30. So it's like
Cool.
it's a long day, but it's a fun day.
Yeah.
It goes by quick.
We try to
Yeah.
make it fun.
Mm-hmm.
You were recently recognized with awards. What do those awards mean, and what does it say about the care being provided here?
I mean, it was an honor
Yeah.
to be. I was awarded the Learn Award, and it basically follows the DaVita way of we care. So it's you welcome, you empathize, you connect, you actively listen, you respect, and you encourage, because you kind of have to put yourself in the patient's shoes. It's very, very hard for them to come and do this, and it takes a team. So I feel like the award is such an honor, but it's not just for one person. It's based on team effort, and we have an amazing team. So yeah, I mean,
Cool.
yeah.
Amanda went to New Orleans for her award.
I did. I went to
Yeah.
New Orleans, and that was an amazing experience, and I got to meet a lot of great people, nurses that also won the same award, and it was amazing. So it was definitely an honor. And Amy won the Daisy Award.
I got the Daisy Award. So Daisy stands for Disease Affecting Immune System. And the Daisy Award was established back in 1999. There was a patient, his name was Pat, and he had an autoimmune disorder. And he ultimately passed away, unfortunately. He was young. And his family wanted to honor him by recognizing the amazing care that he got from the nurses while he was in the hospital. So they created this Daisy Foundation that is worldwide, and it recognizes a very, I mean, I hate to say this about myself, but like empathy, compassion,
Yes.
going above and beyond nurse. And so one of my teammates nominated me, and usually they announce the Daisy Award winner during Nurses Week, which was last week.
Yeah.
Yes. So they surprised me. It was not fun. Well, it was fun, but it was not fun.
We don't like surprises.
I don't like
Amy and
surprises.
And we were both surprised.
And I came out and they were all on the floor with the award, and I walked off the floor. And Amanda goes, "You have to come back on the floor." And I said, "I don't want to." So it was nice. Like, it was a beautiful thing.
Yeah.
And yeah, I was shocked.
That's cool.
Yeah.
About how many people... Wait, sorry. What would you want the community to know about dialysis care and the people who provide it?
I would say that I would tell the community and anybody out there that dialysis patients, they amaze me. Their strength is incredible because it's like having a job. You have to come to treatment 3 days a week, and you have to sit for hours, and it's hard. And not only that, but your lifestyle has to change.
Yeah.
So it's not just cleaning your blood. It's you have to manage your diet. It really disrupts their life, and it's just very amazing to me how strong they can be and show up for their treatments and just keep pushing to live. So
Yeah, and I would say for dialysis patients, transportation is a battle every day. This is a rural area, so these patients are coming from far away. And like Amanda said, we're always thankful that we're here, because if we weren't here, these patients would be traveling even farther for treatments. But I was talking to a patient the other day, I did not know this, and I said he relies on the county transportation. And I said, what time do they pick you up in the morning? And he said, 4:15.
Yeah.
Whoa.
In the morning.
Yeah.
He gets on that
So think
bus
about that. He has to get up way earlier
than
Wow.
that. 3 days a week. So he gets on the bus at 4:15. He gets to us because they'll combine, patients and put like 3 or 4 on the bus. So by the time they get to us, what are they pulling? 5:45?
Yeah.
So he's on the bus for an hour and a half.
Wow.
And then he's here with us for 4+ hours because the treatment's 4 hours, but putting on, taking off, you want to add in like probably another hour. So 5 hours physically with us. Then back on that bus for another hour and a half.
Yeah.
Wow.
So it's an entire day.
It's a long day.
Yeah.
Yeah.
And a lot of our patients depend on county transportation, and it's hard.
Yeah.
It's very challenging for them.
Yeah.
Yeah.
About how many people come for dialysis?
Aiden, this is a new question.
Okay, that is not on
That
the
is
list.
not on our list.
Did you throw that in there?
You did change the questions.
You did.
You know.
So we upstairs, we have 12 stations. So we can do dialysis on 12 patients at a time, and we do 2 shifts. Now, overall, DaVita is all over the United States. They treat 200,000 patients
Wow.
and have 55,000. We call ourselves teammates.
Yeah.
So
Cool.
yeah, we're everywhere. But here in Tunkhannock, we're small but mighty.
Yeah, small but mighty.
Small but mighty.
So we can do
Yeah.
24 patients, 12 at a time. So
Cool. Thank you for your time. Before we end the podcast, can I please tell you a joke?
you absolutely
Yes.
can.
What do you call a nurse who is happy, relaxed, and smiling?
Oh, Amy and Amanda. The raccoons! You call them the raccoons.
That's right, Amy and Amanda the raccoons.
What is it?
What is it?
Off duty.
That's really good.
Thank you.
That's a good one. I
Thank
like
you.
it.
I love it,
Thank
Aiden.
you.
Oh
Aiden,
my
thank you
gosh.
so much for having us.
Yeah, this was
Absolutely.
great. Thank you so
amazing.
much.
You're
Yes,
amazing.
Yes, thank you. Thanks for watching Health Matters by Wyoming County Healthcare Center. I'm Aiden. Thanks for watching.